We will discuss skin conditions and the associated disease. This is a very high-heeled topic for you, Usmle. So let's discuss. First is acanthosis nigricans. Acanthosis nigricans is present in insulin resistance and associated with metabolic syndrome. And it is also a major manifestation of gastrointestinal or genitourinary malignancy. It is characterized by areas of dark and valvulity discoloration in the folds and creases. So it can be present anywhere, like in the neck, in the genital area, in the armpit, and the affected skin can become thicker. Here is a diagram showing acanthosis nigricans. Usually you will be given a obese female or a obese man. Next is now if a person has multiple skin tags, it can be due to underlying insulin resistance or it can be due to underlying in pregnancy. It is a physiological phenomena that occurs. If there are multiple perianal skin tags, it can be due to Crohn's disease. Okay, perianal skin tags, Crohn's disease. Now, dermatitis herpetiformis is associated with celiac disease. In dermatitis, we find vesicles in the elbow, extensor surface of the elbow. Now, sudden onset psoriasis, HIV. Screening for HIV is needed. Or infections like recurrent herpes zoster or disseminated molluscum contagiosum, do HIV screening in these patients. Severe seborrheic keratitis, seborrheic dermatitis first. Dermatitis is, you think of it as derma is getting more oil and it's getting sticky. It's just like dandruff. So in the first image, we can see seborrheic dermatitis. Okay, and it is associated with HIV infection and Parkinsonism in disease. Second is seborrheic keratosis. Keratosis is keratin proliferation and it gives a black distinct color. A black distinct color in case of seborrheic keratosis. It is found in gastrointestinal malignancy. There are many in number in gastrointestinal malignancy. Pyoderma gangrenosum is found in inflammatory bowel disease, and in STEP they can also show you this picture. You have to remember that this is Pyoderma gangrenosum. We can see the tissue, necrotic tissues and surrounding gangrenous material in this one. Now hepatitis C. For hepatitis C, remember three P's: porphyria cutanea, palpable purpura, and lichen planus. Palpable purpura can be due to cutaneous leukocytoclastic vasculitis, or it can be secondary to cryoglobulinemia. Sarcoidosis. Sarcoidosis is associated with erythema nodosum or lupus perineum. We can see in image this is erythema nodosum. It is mostly on the shins or in the leg area, and it is erythematous and nodule appearing lesions. Lupus perineum is line-like facies where there is redness on the cheeks and there is also redness on the nose area. Next is vertigo. Vertigo is present with many autoimmune diseases like Hashimoto's and Graves' disease. Thank you for watching and subscribe. Ring the bell icon now. Thank you.